Good everyone. I am Sachita, Assistant Professor in Emmanuel Research College of Nursing. Today we are discussing about the class second year BSc Nursing, 4th semester, Adult Health Nursing 2, Unit 3, Urinary Disorders, Renal Calculi. Definition of the renal calculi. Renal calculi, also known as a urolithiasis. It is a kidney stone disease where a solid piece of material, kidney stone, occurs in the urinary tract. Renal calculi, also known as a urolithiasis. It is a kidney stone disease where a solid piece of material, kidney stone, occurs in the urinary tract. Next, we are see about the etiology of renal calculi. First, idiopathic supersaturation of urine, obstruction with urinary stasis, urinary tract infection. Medications may induce calculus formation. Example, calcium carbonate and sodium bicarbonate and aluminum hydroxide. Massive dose of vitamin C increases urinary oxalate levels. Risk factors: immobility and sedentary lifestyle, dehydration which leads to supersaturation, previous history of urinary calculi, imbalance pH in urine. Metabolic disturbance that result in the increased in calcium or other ions in the urine. Dietary intake count. Normal uric acid levels are 2.4 to 6.0 mg per deciliter in female and 3.4 to 7.0 mg per deciliter in males. High mineral content in drinking water. A diet high in purines, oxalate, calcium supplements, animal proteins. Prolonged individual catheterization, neurogenic bladder, flaccid or spastic. This is also the risk factors of renal calculi. Next, types of renal stones. First, calcium oxalate. Second one is the calcium phosphate stone. Third one is the Struve stones, uric acid and cystine stones. First of all, calcium oxalate stones. Incidence level 35 to 40%. The stone color is the black and dark brown color. Sensitivity radio opaque. Then calcium phosphate stone. Incidence level is 8 to 10%. Color dirty white color. Sensitive radio opaque. Struve magnesium ammonium phosphate stone. Incident 10 to 15%. Color is dirty white. Sensitive radio opaque. Uric acid incident 5 to 8%, color yellow reddish brown color, sensitivity radio lucent. Cystine stone incidence 1 to 2%, color pink or yellow color, sensitivity radio opaque. Then pathophysiology, stone formation process, saturation leads to the supersaturation, leads to nucleation, liquid to solid. Then leads to the crystal growth and aggregation, hard mass. Then leads to the crystal retention, leads to the stone formation. Stone formation process, saturation leads to the supersaturation, nucleation, liquid to solid, crystal growth and aggregation or hard mass leads to crystal retention, stone formation. Calcium and oxalate come together to make the tiny crystals, leads to the supersaturation, promotes their combination, leads to the continued deposition at the renal papillae, leads to the growth of the kidney stones. Kidney stones grow and collect debris, leads to the kidney. The kidney stones block all routes to the renal papillae. The complete stone forms and retention occurs. Next, we can see about the clinical manifestation of renal calculi. First, severe radiating flank pain. It is a sudden onset. Next, dysuria, a painful maturation or difficulty in urinations. Cloudy or foul smell urine, dribbling of maturation, anuria and oliguria. Nausea, vomiting, elevated blood pressure and pulse. Diaphoresis means increased sweating, infection, mild fever with chills. Urgency, frequency, pyuria, sometimes presence of pus in the urine, hematuria, sometimes presence of blood in the urine, leukocytosis and ESR. Diagnostic evaluation, first we have collect the history of the patients, next physical examination, inspection, palpation, percussion, auscultation, then imaging studies. CT scan and MRI may be used to differentiate a non-opaque stone from a tumor. Urine analysis, urine examination, culture and sensitivity 24 hours, urine collection. Hematological studies, the serum, calcium, phosphorus, magnesium, bicarbonate, uric acid, blood nitrogen level, RFT and CBC. Next is cystoscopy. Abdomen and renal ultrasound will identify the large radio-opaque stones. Next, IVP, intravenous pyelogram or retrograde pyelogram is used to localize the degree and site of obstruction or to confirm the presence of radiolucent stone. Medical management, watchful waiting or hydrotherapy, diuretics, narcotic analgesia, PPI, syrupcitol and alkalizing agent, antibiotics and acids. Implementary dietary changes, antiemetic, mild sedative if pain is severe, and loop diuretic. Medication to prevent or dissolve the calculi, D-penicillamine, captopril for cystine calculi, pyridoxine or cholestyramine to prevent oxalate stone, allopurinol for uric stones, hydrochlorothiazide potassium citrate to prevent calcium oxalate calculi. Surgical management, percutaneous nephrolithotomy, PCNL, percutaneous nephrolithotomy is a minimally invasive procedure to remove stone from the kidney by a small puncture wound through the skin. It is the most suitable to remove stones of more than 2 cm in size and which are present near the pelvic region. Extracorporeal shock wave lithotripsy, ASWL, extracorporeal shock wave lithotripsy is a type of treatment for kidney stones. It is used high energy shock waves to break down the kidney stones into the small crystals. Next, ureterolithotomy refers to the open or laparoscopic surgical removal of stone from the ureter. Nephroscopy is a non-surgical way to examine the inside of the kidneys and treating certain conditions in the upper urinary tract. The thin flexible tube part of the nephroscope is inserted into the skin through a very small cut. Cystolithotomy is a urological procedure to remove one or more bladder stones. It is typically performed for a patient with a large or numerous bladder stones or if an endoscopic approach has not been successful. Vesicolithotomy is generally performed in the patients with invasible or surgically ablated urethra. Electrohydraulic lithotripsy. It is used to electrohydraulic device with a flexible probe to deliver electricity that breaks apart the stone. Urethral double J, DJ stents. A urethral stent or ureteric stent is a thin tube inserted into the ureter to prevent or treatment obstructions of the urine flow from the kidney. Complications of the renal calculi: kidney failure, urosepsis, hematuria, uropathy. Thank you.